Your doctor called, or you just came out of an appointment and they've told you to go to hospital, and you're sitting there thinking, do I really need to go? Maybe you're not feeling that bad. Maybe you're worried about what happens when you get there. Maybe you just don't want to be admitted. Maybe you're hoping if you wait a little longer, it'll pass. I understand that, and in this video I'm going to help you make that call clearly, calmly and safely. You're not being dramatic, you're not overreacting. This is one of the hardest calls to make when you have heart failure because the stakes are high no matter what you decide. And most people in this position feel exactly the same way. They've been told to go, but they're hesitating. I'm Dr. Jodie Ann Senior. I'm a cardiologist and heart failure specialist, and I want to help you figure this out right now. By the end of this video, in about 8 minutes, you're going to know the signs that mean go right now, no questions. The signs where you can call your doctor first, what actually happens when you get to hospital, so it's not so frightening and unknown, and exactly what you bring if you do go. Let's get into that. Let me start by acknowledging something. The instinct to wait is understandable. People with heart failure often build up a very high tolerance for feeling unwell. You've learned to manage symptoms, you've learned to push through, so when things get worse, there can be this temptation to apply the same approach. Just wait, see if it settles. But here's what I need you to understand, and this is really important. With heart failure, the window between I'll wait a little longer and I needed to go hours ago can close faster than you think, and you don't have the time you think you do. But I want to stress something else more important. Patients all tell me that they wonder why they waited so long to go to hospital, or those that were told to go by others were really grateful they listened. Going to hospital earlier almost always means a shorter stay, less aggressive treatment, and a faster return home. Waiting longer almost always means the opposite. And in my experience, I regularly see patients that when they didn't wait, they were so grateful. So let me give you some clarity on what the signs actually are. These are the signs where my advice is clear. Do not wait. Do not call the clinic first. Go to your emergency department, or in Australia, call 000. That might be 999 or 911 where you are. 1. Severe breathlessness at rest or with the smallest amount of effort. Not breathlessness walking up flights of stairs, breathlessness sitting still, breathlessness getting dressed, breathlessness going to the bathroom. Think of the heart as a pump and the lungs as a sponge. When the pump isn't working properly, fluid backs up into the sponge, into the lungs. When enough fluid is there, breath becomes genuinely hard, not uncomfortable, hard. This is not a call the clinic in the morning situation. This is a go now situation. 2, you can't lie flat. You need to sleep sitting up. If you're propped up on 3 or 4 pillows, or you're sleeping in a chair because lying flat makes you too breathless, that's a specific and serious symptom. We call it orthopnea. What's happening is that when you lie flat, fluid redistributes in your body and rushes back towards the lungs. Your body knows this and forces it upright. This is your body sounding an alarm. Please listen to it. 3. Chest pain or pressure. If you have chest pain, especially if it feels like tightness, heaviness, pressure or squeezing, please do not wait. This is not a symptom to manage at home. People with heart failure can develop other cardiac problems on top of their heart failure, including blocked arteries. Chest pain in a heart failure patient is an emergency until proven otherwise. And even if it's not your heart, don't you want to deal with it? If something's causing you that much pain, please get it checked out. 4, you passed out, nearly passed out, or feel like you might pass out. Syncopal episodes, blackouts or near blackouts in heart failure can be a sign that the heart's electrical system is struggling or that your blood pressure has dropped to a concerning level. Either way, emergency department now. 5, rapid weight gain combined with worsening symptoms. If you've gained more than 2 kilograms in the last 24 to 48 hours and your symptoms are getting noticeably worse, more breathlessness, more swelling, more fatigue, that's a significant red flag. Weight gain in heart failure is fluid gain. 2 kilograms of extra fluid in less than 2 days means your body is retaining what it should be getting rid of. That's a signal your medications aren't keeping up. If you don't already have an action plan for this one, go to hospital. This combination, weight gain and worsening symptoms, warrants urgent assessment. Don't wait for tomorrow's clinic opening. Now, there's an important middle ground. Not every situation is an emergency department situation. I get it. Sometimes the right first step is calling your heart failure nurse, your GP, or your cardiologist's rooms. Think of it this way. If your symptoms are now new or worsening, but you're not in immediate distress, then calling your team first is reasonable. They may be able to manage this with a medication adjustment. Some of you will have a plan, and you can avoid a hospital admission altogether. The kind of situations where a phone call first makes sense is when your weight has crept up 1 to 2 kilograms, but you feel only mildly more breathless or little bits more swollen, not dramatically worse. Your ankles are more swollen than usual, but you're not breathless at rest and you can still lie flat. Or you're feeling more fatigued than normal, but your other symptoms haven't changed much. These are amber zone situations. Your body is telling you something, but there's still a window to act before it becomes an emergency. If you call your team and can't get through, or if the situation is deteriorating while you wait, don't sit on it. Go. Little tip for callers: when you call, lead with your weight change. Tell them, my weight is up X kilograms from my usual baseline weight. This immediately orients the clinical conversation. One of the biggest reasons people delay going to hospital is that they don't know what's going to happen when they arrive. The unknown is frightening, so let me take that away. When you come in with worsening heart failure, here's what typically happens. You'll be assessed in the emergency department. The team will take your observations: heart rate, blood pressure, oxygen levels, respiratory rate. You'll have some blood tests, including a brain natriuretic peptide or BNP level. That's a marker that tells us how much stress your heart is under. You'll also have kidney function checked because the diuretics we use will remove fluid and your kidneys need to work with us. You'll have an ECG, a tracing of your heart's electrical activity, and you'll have a chest x-ray which will be taken to look for fluid in your lungs. If you're short of breath, you'll get likely oxygen and IV or intravenous diuretics. These are fluid medications that help you lose the water. The medications are given directly into a vein to help your body remove the excess fluid quickly. This usually starts to work within an hour or two, and most people feel meaningfully better within the first day. Most admissions for decompensated heart failure, that's the medical term for when heart failure flares up, last between 2 and 5 days. The goal is to get you dry, get your medications optimized, and get you home safely. It's not a pleasant experience, but it is a correctable one, and the sooner you go in when you need to, the faster that correction happens. Quick practical note: if you are going to hospital, bring a list of all your medications, or bring the actual boxes. Bring your heart failure tracking kit if you have one, and if you don't have one, I've put the link in the description. It's free. Or write down your recent weights and which zone you've been in. Bring your care team contact details, your cardiologist, GP or heart failure nurse. Pack overnight things: phone charger, comfort items like pajamas. Even if you think it's a short visit, please be prepared. Being prepared doesn't mean you're assuming the worst. It means you're being sensible about your own health. So, to bring it all together, if you have severe breathlessness at rest, you can't lie flat, you have chest pain, you've nearly passed out, or you've gained more than 2 kilograms quickly with worsening symptoms, please go. Don't wait. If your symptoms are worsening but you're not in immediate distress, call your team first. They may be able to manage it. But if they can't be reached or things get worse while you wait, go. And if you're not sure, go. A trip to the hospital that turns into A precautionary one is always better than a delay that wasn't. One thing that can really help you with this, and it's completely free, is my heart failure tracking kit. It has a color-coded action plan inside it, green, amber, orange and red, that tells you exactly what to do based on your weight and your symptoms. It's designed so you never have to guess which situation you're in. The link to the download is in the description below, and it's one page, print it out, put it somewhere you can see it. It's totally free. And if you want to read the article that gives you the blow-by-blow instructions on what to do, then follow the link in the description to this and other articles written to help people like you and their families who support them. And if this video helped you, please subscribe. I'm here every week with plain answers to the questions heart failure patients are actually asking. And I'll see you in the next one.